excited to introduce this outstanding expert panel to you guys today about a topic that, quite frankly, is impacting so many of our families' lives. I don't know what the percentages are per family, but it's staggering. So we're going to talk about basically user-friendly information about dementia, memory care, Alzheimer's, all the things that wrap into that whole world of memory issues. So, and we've got a great cast here today. So I'm going to kind of go through. I pulled down our sheet, and so I'm going to just go down through that. So Hadia So is with Alzheimer's Association. We're thrilled to have her here. Vicki Greenow is American Seniors Community, and boy is she with American Seniors Community. We'll get to her in a second. Allison Krebesh is with Brookdale Carmel, which is 100% memory care. Melinda Winnie with Socoa, and if you don't know about Socoa, you're going to know a lot more here in a minute. Regina Smith with Independent Adult Day, and Jesse Hillock with the Memory Compass. So, which you're going to have to explain that to people because most people probably don't know what that is. So let's just start with Hadia. Introduce yourself. Tell me about Alzheimer's Association and what you do there and what they do there.
Thanks, Jim, for the opportunity. It's always good to be on this panel and with this amazing group of women. So I have the pleasure of serving as a senior program manager at the Alzheimer's Association. And what that means is I get to work with families every day and the general community, just providing education about what Alzheimer's is, because it's really important that we know. You just never know who in your life it might impact, whether it's a family member, a friend. So I know it can seem like a really scary disease, but it's really great to just keep yourself informed for all those around you. And so I provide those education programs. I also work to make sure that people are aware of what free resources are available to them. So like I said, it's a pleasure to be here and I can't wait to share more information. Excellent.
So Vicki, please introduce yourself and your role and what you cover a lot. We'll all sit back for a while, let you explain your role. So yeah.
Oh, it might take a while just to get my title out. My name is Vicki Greenow, and I'm the Memory Care Business Development Specialist for American Senior Communities. So what does that mean? That means that I support all of our communities within the state of Indiana, to include one in Kentucky, that offers a memory care living option. So whether that's assisted living or long-term care, memory care living option for those who are living with Alzheimer's and like forms of dementia. And so I support our buildings through education and through coordinating and collaborating with many organizations such as those that are represented here today on this panel, and just really helping folks guide their way through the healthcare system to make sure that they receive the right level of care at the right time in the right environment. So that's basically what I do. Happy to be here.
Thank you. Allison.
Hi, thanks, Jim. So I am the sales manager at Brookdale Carmel, which is a freestanding memory care and Alzheimer's community located in Carmel, Indiana. We are part of Brookdale Senior Living, which is the nation's largest provider of senior living options for older adults. So very similar to what Vicki does for her communities, my corporate does for ours, and sharing that knowledge and education so that we can then share it with our team and with our families. And my main goal is to assist families with that process if they are looking to move into a community to provide more support for their loved one.
Well, thank you. Melinda.
Hi, everybody. Melinda Winnie. You can also call me Mindy Winnie. I'm a dementia education specialist at Socoa Aging and In-Home Solutions. And before I kind of segue into Dementia Friends Indiana, let me just share a little bit about Socoa. We are the largest area agency on aging here in the state of Indiana, covering Marion County and the 7 donut counties or surrounding counties. We provide a wide range of services from information and referral services, phone-based services, to care management, nutrition, transportation services, caregiver support, minor home modification projects. The list kind of goes on of all of what Socoa does. It's kind of a one-stop shop and in a lot of different ways. But another unique program that we became the state administrator for about 3.5 years ago is the Dementia Friends Indiana initiative. And so just really quickly about that. So Dementia Friends Indiana is part of a larger global initiative, which started over in the United Kingdom through their Alzheimer's Society. And I'm really proud to report that last number I saw, there were 56 different countries who had come on board and adopted this initiative. And really the goal of the movement is to raise the general public's awareness of dementia. What are the signs? What are the symptoms? Giving them communication tips to more effectively engage with these individuals. But I would say the biggest goal, and aside from just raising awareness and helping folks better understand the condition, is to break down the stigma, to get people talking about it. I think that is, everybody on this call can agree that that is the greatest hurdle that so many families face, is just knowing how to have conversations about it and just to not be in denial. So a lot of what we do is just trying to kind of share that hope, not minimizing the condition in any way, but just showing folks, like Hadya said, that there are resources available, many of which are free or low cost, great resources to get connected with, and then just helping folks understand what small actions they can take as dementia friends to really provide a better quality of life for people living with dementia. So that's really what I do. I coordinate this movement across the entire state of Indiana, working with all of the area agencies on aging here in the state. So I'm excited to share more, and thanks for having me.
Well, thank you very much. Regina.
Hello, everyone. I'm Regina Smith with Independent Adult Day Centers. We are fairly new and not so new now. We've been around going on 4 years now. I can't believe it. So yeah, we're a growing adult day center here in Indianapolis. We have 3 locations. And we specialize in all types of dementia as well as just aging diagnosis that adults from age 18 and over. So if your adult is age 18 living with a mental disability or physical disability such as MS or any other type of physical or cognitive disability, they are welcome into our community just as well as those that are living with Alzheimer's or dementia. So that's a different spin from the Alzheimer's and your Parkinson's and those types of dementias, because a lot of folks don't know that those two communities can actually live together. So we do have accommodations for both. Not only do we have adult day for folks with dementias and those other types of diagnosis, we also have home health care now. And we provide physical therapy in our space. We provide lunches and transportation. So that's just a little bit about Adult Day. But like Melinda and like Hadia and like the rest of my colleagues here, I think the biggest thing for me is just the passion and spreading the word about what we do in providing care, quality care for our guests, for our clients, and for our caregivers, letting them know what is out there for them, providing resources upon resources upon resources upon resources, getting them connected to whoever, whatever, wherever, so that they are not lost in this aging process. And so that's who we are, and that's what we do.
Well, very good. Jesse.
Hello, I'm Jessie Hillock. I'm the owner of the Memory Compass. We are very new, started April 2019, and then started seeing Medicare beneficiaries January 2020. So quite the year to start a business, but it has been wonderful. So the Memory Compass is credentialed with Medicare Part B. That's considered just an outpatient therapy service for individuals who are coping with a memory impairment of all the dementias. So vascular, Lewy body, Alzheimer's, we help in all of those areas. But why we do what we do is because I had worked for 7 years in a skilled nursing facility, And a lot of people, if you're not familiar with that type of a space, when your loved one transitions for either rehab to home, assisted living, memory care, or long-term care, anytime they're demonstrating a cognitive decline, they would get referred to a speech language pathologist. And that is my background. People don't realize that a speech language pathologist works not only on communication and swallowing, but also works on following directions, problem solving, safety awareness. And as we know, dementia impacts your cognitive communication skills. And I realized that people were not receiving that type of a service until they were already transitioned into either a memory care, assisted living, or long-term care. And so I wanted to create the Memory Compass to bridge the gap of receiving a diagnosis and helping meet families where they currently are to try to maintain where they are before needing to transition into a long-term care or memory care or assisted living environment. So I go into the home and provide an assessment, determine where your loved one is cognitively, stage them, and from there, be able to give not only the patient, but also the family, the tools and strategies about how to adapt their home and how to best communicate with their loved one to decrease, breakdown in communication. We also provide occupational therapy services, and we also provide virtual coaching sessions for families who are, trying to navigate what do we do now after my loved ones receive this diagnosis. And we are excited to be doing that not only in Indiana, but also providing that. We've done these virtual coaching sessions in New York and in California, and it has been wonderful to be able to provide that education to families. So that is the Memory Compass.
Well, very good. And I'll tell you what, you brought my segue into the next step here for what I wanted to say. So you brought up the fact that you were bringing up the different types of dementia. So I think that as a general rule, the public has a tendency to put everything under Alzheimer's. And it is not, there's a lot of different things under that. Could you guys, and this is not to any particular one of you, all of you weigh in. Could you explain to our watchers what kind of dementias are out there, what causes those, and what the differences are, so that, in some kind of capacity, so we have an idea from a starting point? I don't care who starts.
I
Cassie?
thought Jesse would
Okay.
probably take the lead on that, but basically there's an umbrella, and dementia is the umbrella. And if you think about all the prongs coming off of the umbrella, that would be all of your different types of dementia. So it might be Alzheimer's, it might be Lewy body, it might be Parkinson's, it might be vascular dementia, it might be dementia related to AIDS or dementia related to alcoholism and drug abuse. So pretty much any chronic illness or ailment that you could have could potentially cause some sort of dementia. And the way that it's diagnosed is based on your medical history, as well as the type of symptoms that are being presented to the physician as they're doing that evaluation. So Jesse, I don't know if you have anything else to elaborate on that, but that's kind of short and sweet of it. It's based on a lot of different factors to determine which type it is.
I think you did a great job.
Thanks.
One thing that always helped me just to kind of think about it in a very simplistic term is that Alzheimer's disease is always dementia, but dementia is not always Alzheimer's disease. I heard that probably about a year ago, and it just is always, with all that I do know and all that I still have yet to learn, that one phrase has always just stuck with me, and it's always helped me kind of be able to separate the two. Another analogy that I kind of find helpful personally is almost thinking like dementia, because dementia is a collection of symptoms. So it's almost thinking of it like if you have the symptom of a fever, you don't just have a fever that's standing alone. You have a fever because there's some underlying cause of that fever. So just a couple little analogies just to throw out there again for the general public that just, try to break it down in the most simple terms. So
another analogy that has helped me, which Mindy, I think you were actually the one that gave it to me, but you can think of dementia kind of like cancer.
Yeah. Yeah.
right? So when we think of cancer, it's cancer, but there's different types of cancer. There's ovarian cancer, breast cancer. So if we can wrap our heads around that, dementia works similarly. There are different types of dementia. Alzheimer's is the one we hear about because it impacts 60 to 80% of people who have a dementia. But then there's the more common ones. So the big four to know about are vascular dementia, Lewy body dementia, and frontotemporal dementia. So they all come with their own different sets of symptoms and challenges. And that's why we say it's so important to find out exactly what type of dementia you have. Because some people will get a diagnosis or they'll see the symptoms of dementia and say, well, I have dementia, that's it. And that's not typically the case. So it's very important that you find a physician who can give you an accurate diagnosis, and that way you can seek help based on what you have. And although there is no cure for dementia, there are medications that help with certain symptoms that come with certain types of dementia. And there are also certain medications that you should not take with certain dementias, like Lewy body dementia. So it's very important for one's health to be aware of which and what kind. And there's mixed dementia. I should throw that out there too. You can have multiple different types of dementia. You can have dementia that is actually from an infection, as Vicky mentioned, that is not actually, that is treatable. So it's just really important that if you see any of the signs of dementia, to make sure what type of dementia it is and why you might be displaying those.
Could you define those dementia, those four that you just tell what that means, other than, because, you guys, that you live it, but somebody that's watching may be trying to figure out what's going on with mom,
I will pull up a really good definition of each of them for you, because
Okay.
I don't want to give you the general. With vascular dementia, that one is specifically an impact to the brain's ability, the body's ability to get blood and oxygen and all kinds of nutrients. So that's why we say there's a connection between the heart and the brain, right? What we do for our heart is good for our brain. What we do for our brain is good for our heart. So let me pull up those definitions. That way I give them to you and not just my thrown together. This is what it is. And I will share that again. Thanks for that question.
Okay, and Lewy body, you're pulling that up as well or whatever, because I just, like I said, I'd like to have that for people to, because that was very eye-opening to me when I started going to dementia friends and stuff like that, when I had no idea that there were so many different things and they caused by different, things. And like the Lewy body, I going to a Parkinson's thing, found out that it's the same thing, but like opposite or something, that type of, but anyway, so those are interesting things to me. So when someone is dealing with, they've got a family member that they're starting to question, what are some things that they should be looking for? What are some of the first steps that they should be doing? Let's help guide people through that process.
So when my mom was first starting to show signs of dementia, for me, the telltale sign was my mom was once diagnosed with OCD. So, she was extremely clean and very meticulous. And so for a telltale sign for me was she stopped being, the compulsion stopped. She wasn't bathing. Her house was not clean. Her clothes didn't match. She had to have, she was very meticulous about her outer appearance and things. And so I noticed that. And then her utilities, I was like, when did you stop paying light bills? What? You don't do this. And so I noticed things like that. And then she started eating the exact same thing. And I was like, why do you eat spaghetti every day? And so she was like, it's because I love spaghetti. And I was like, no, you don't. You like spaghetti. But so this went on for months. And I was like, this lady, this is really weird to me. So she just started having these weird behaviors. Now, granted, I have worked in healthcare and in elder care for a very long time, for 34 years, and have seen dementia and Alzheimer's in all types of decline. But when this monster came to my back door, I did not recognize it. So to say I had, just because I've seen it so many times, when it came and smacked me in the face, it caught me totally off guard because my mom, she does like spaghetti. She liked spaghetti and fish on Fridays, but when she started eating it every day, it took some months for me to pick that pattern up. It took a minute for me to understand that her lights kept being disconnected. It took a couple months for me, like, something's not right there. What do you have on? So there, those signs. I just started noticing things like that, the untetheredness, and then start seeing and hearing those things within my own patients. Working because before I started adult day, working in a nonprofit, I worked for a family physician, a private physician. So I started seeing it in my patients and hearing patients come into the office and start complaining of what they thought were UTIs or being on certain medications. They thought I think there was a medication that they were taking, Detrol or something, for bladder control. And we thought that was causing. So just seeing little things like that kind of go off the radar made us start looking at possibilities that there was some type of decline happening to that individual. So you just start noticing those little signs in people's homes. People, they become paranoid, start accusing you of things. I remember a couple been married for 50 years, and all of a sudden the lady didn't recognize her husband. She was sitting at the table with him having dinner, and she called the police because this man that she had been having dinner with for 50 years was no longer her husband. She just out of nowhere did not recognize him and called the police and said, "There's a stranger in my home." So things like that begin to happen. And so when you start seeing, and they can happen that quick, just that instantaneously. Yesterday was fine, and today it's not fine. So when you start seeing things like that, it's time to make that call. It's time to, and that call sometimes is an ambulance. Sometimes it's not to the doctor. Sometimes it's straight to the emergency room.
Does anything like that ever happen where all of a sudden that moment where that total confusion and then it passes and then next day everything's fine and stays fine for a period? I mean, those, from what I understand, it seems to be not something that's it doesn't fit into a box all the time.
Ebbs and flows. You think about people who, before you actually take their cars from them, when the first time they get lost and they don't tell you they were lost, and they know they were lost, and they knew they had to figure that out, and within themselves they had to figure it out, and they didn't tell anyone, and then they got lost again. They probably were lost a couple of times before you ever found out, or before that car accident happened, or before the police found them and brought them back.
Well, I know in Dementia Friends, they talk about that one of the points of being a dementia friend is to identify someone maybe at the grocery store or at, standing for a bus or whatever, that's having a moment, a dementia related moment, and then help them to guide them through the process. But that means that person is in the community, living their life or what have you, and then having those flashes. Could you guys kind of expand on, because I imagine a lot of families dismiss this idea. First of all, I think that you have an innate tendency to not want to even think about it. Okay, so it's like the la 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 type moment. But how can we, like I said, can you talk about how people can live within the world and then have these moments? I think one of the terms we hear a lot is sundowners. Can you kind of expand on what all that stuff means? I don't care who takes the lead here.
So, I kind of want to touch on something about the ebbs and flows. If you think about yourself when you read a book and all of a sudden you become tired and you're having a hard time concentrating on reading that book. So the same is true with those individuals with Alzheimer's and like forms of dementia, is they may have something going on one day that requires a lot of concentration. For instance, maybe a visit from family where they have to be on their best behavior or present that nothing is wrong. Or it's a day filled with physician's appointments where they're being asked a million questions that they're trying really hard to answer accurately. And then the next day, because they're so tired from having to be on stage, so to speak, that's that day that they become a little more confused or have a little more, are challenged more with their cognitive abilities. So it comes down to really being able to concentrate. So when we talk to families and they say, gosh, I'd really like for you to come assess my mom in the morning because she's really good in the morning. That's because she's just gotten up from a good night's sleep, hopefully. And then in the afternoon, she's more tired. Therefore, she could have more problems with cognition, which also leads into that sundowning piece that you were talking about, Jim, where they get their nights and their days confused, very similar to an infant, how you're trying to get an infant on a good cycle. We try to do the same with those with Alzheimer's and like forms of dementia, and really trying to keep their personal clock set with their circadian rhythms through activity and programming and structure, which will allow them to stay engaged throughout the day and reduces that opportunity for increased confusion and sundowning in the evening hours. Anybody else want to add to that?
I don't want to touch on sundowning, but one other thing is that I hear often, well, my loved one's memory is better than mine. They can recall things from 30 years ago and things I don't even remember. Well, you know, the long-term memory stays intact, but the short-term, for some of the dementias, but the short-term memory does not stay intact. So, you know, being able to say what they ate for breakfast a few hours ago, or what they had for dinner the night before, or not recalling maybe who came to visit the day before, you know, that is a sign right there that families should look out for as well.
I think to build off what you just said, Jesse, you know, because some of these long-term memories that are still, they're holding on to them so tightly, those are attached to feelings and emotions. And that's what really remains for the longest period of time throughout this condition. It's that outer part of the brain, the facts, the figures, the math, all of that. That's what we tend to lose first. You know, knowing how to just pick up a toothbrush and brush our teeth. But I think, you know, maybe I'm just throwing out a wild guess, but I would imagine that a lot of those long-term memories that are still housed, they're still so attached to some feeling that's still housed within there. Jim, you touched on an interesting point when you're talking about these folks in the community, talking about seeing them in grocery stores and restaurants and the bank. And one thing I just wanted to point out really quick, and something we talk about in the Dementia Friends sessions, is that 80% of people living with some form of dementia are either living in their own home or they're living in a community-based setting. So that might be with a family member, that might be assisted living, that might be independent living. But regardless, the majority of these folks living with some form of dementia are still in a home and community-based setting. So I think that's so important for us to wrap our minds around it. You know, a lot of these folks sure have moved on to, you know, to live in more institutionalized or long-term care facilities. But still the vast majority of these folks are still living amongst us. They're still our neighbors. We're still seeing them in church. We're still running into them in the places that I mentioned. So I just wanted to point that out. And then Dementia Friendly America, I saw a report, gosh, it's been quite a few months now, but they had found that about 1 in 5 people living with dementia actually live alone. So that's another pretty significant statistic as well, that, you know, a lot of us think, again, you know, that they've kind of moved into that long-term care setting. They're not able to live on their own anymore. And a lot of us assume that they have a family member or an informal support that is there to provide that care, but it's not always the case. So just a few things to kind of throw out there about how many folks are still in community settings with this condition, and they can still be there. But again, you know, it takes kind of this understanding and this knowledge and knowing about resources like the Alzheimer's Association, everybody on here, but SACOA and the area agencies on aging. Our job in the community is to help educate people about what options they have for long-term care. So again, you know, it may get to that point. It may, you know, kind of, especially with caregivers in the home, at some point there may reach a point where they're just no longer able to provide that care safely themselves. And so knowing when it's appropriate to kind of move on to the next phase. But, you know, in the meantime, I mean, if a caregiver is available to provide support, that's wonderful, but we might be able to bring in some home health aides and some attendant care to lessen the load that these family caregivers are providing for. So I think that's just a big thing, and kind of how we keep these folks in the community is through resource identification and just kind of knowing what's out there, how can we help ourselves in this role. So
Melinda, I think you touched on a really good point there, and that is because we are in times where a lot of our folks that are diagnosed with dementia is not Alzheimer's, are younger, and they have cognitive decline, and they do have diagnosis of dementias. They are very much living as their own caregiver. They're living very much independent. And so with good resources and good programs like that we have, we're able to go in their homes and keep them living as independent as long as they can, making their decisions on their own. One of the good things that I like about what we do is that, especially at our Guyan location, almost, I would probably say 50%, maybe 60% of the guests at our Guyan location are all independent. There's no caregiver involved. They all live in their own apartments with the resources from SACOA. They are able to live at home on their own. They do their own grocery shopping. They may have some assistance from home health care for minimal tasks, but most of the things that they do are on their own. And we provide supports with mostly because of socialization, or the attendant care, getting them to and from, with that coordinated health care, getting them to and from their doctor's appointments. So when you marry all of that together, they live really well. And so that's the beautiful thing about what we all do. We're able to kind of marry each other together and keep a good relationship going. We can call each other, refer to each other. I know I had Vicky on the phone last week, like, I got a TBI and they're going off the chain. Please help me. I need a behavior profile and I don't know what to do with this. I've never seen this behavior before. Help, help, help. But that's what we're here for. And so she was able to give me some pieces that, put my little wheels, because I'm working with older people and their behaviors. And this was a younger person with some sexual behaviors that I had never encountered. And so, other than my teenage kids, so it's like, Vicky, help. So she was able to support me as the professional to help support my guests. And so this guest lives, alone, and he's young, and they have desires, but we still need to redirect those behaviors. And we were able to put a plan in place and keep this person safe and keep other people safe, and, meet his needs and the challenge. So it was great to be able to provide that resource and service. And thank you, Miss Vicky.
Now you brought up something that you say to live in these times where there's more young people getting it. Now, what I classify that as like an early onset, is that the right term for that, or is
this individual has a TBI, which is
okay,
something totally different. Yeah, that's another diagnosis in our midst.
But if we were looking at like a dementia, or like a Alzheimer's or whatever, the early onset, is that something we see a lot of, or how is that different than the I don't know. I'll let you guys, you're the experts. So anyway.
Younger onset is really different because it's scarier, right? When you think of people in the prime of their lives, potentially raising children, young children, older children, and to be hit with this diagnosis, especially when so many of us think of Alzheimer's as an old people's disease. I mean, this is how we hear it. That's a disease that impacts old people. But the reality is that's not always the case. People can get Alzheimer's at very young ages. And I think Mindy and Regina have made a good point that it is possible to still live a good, productive life, even with a dementia diagnosis. So I'm saying three things here, which is that it's so important to get tested, right? And it's so important to know whether or not a person has any kind of dementia. And to Regina's point, as family members, you have to, it's okay if you see one symptom or one sign, that is enough. Jesse, I'm loving this. I'm loving the pet in the background. But it is so important to know. And if we see even one sign, you have to take it seriously. Even if it's just one thing, like Regina saw with her mom, you don't eat spaghetti on Friday or every day. You have to take that as why not just go find out? Why not just go ask a physician if this is what you have? Because then you give yourself and your family members the ability to have more time to have the conversations that you need to have. With early onset, a lot of people take that as, oh, this person has Alzheimer's, it's over. But that's not the case. They still have potentially a very long life to live. And so I say all that to say that, we should be aware. And I also want to throw out for early onset, Jim, I'm glad you mentioned it, because this month in January, we're actually having a 4-part series for younger onset Alzheimer's that provides families who are experiencing this with all the information they need to know. It brings them together in a group to talk to other people who are living with younger onset Alzheimer's. And so I just wanted to share that. Those dates are on our website. We've got January 19th, January 26th, February 2nd, and February 9th. It's a 4-part series, but if you are living with that, I highly encourage you to reach out to us and join that session. So thank you for giving me the opportunity to share that, because not enough people know about it.
I want to add something to that. I think that's an amazing resource for these young onset, for them to have that, because right now about 1/3 of my clients so far have been in the young onset category early on, and the thing that I have found with these patients is that the first sign for them was their doctor diagnosed them with depression. And then they ended up losing their job. But all of the clients, surprisingly enough, were saying, I don't feel depressed. I just can't focus and I can't multitask like I used to. So that is something that I would, want people to look at as well. And, doctors, that's not going to be the first thing when you're 57 to look at, well, could it be a dementia? They're not going to think that right off the bat. So just, is your loved one not able to multitask? Are they not able to sequence like they used to? Are they not, are you noticing trouble with finances? Is their behavior changing? Like, are they snapping? And they've never been somebody to snap before. And I think, just having that resource from the Alzheimer's Association that all of these people can go to, because, some of these clients I've had, the things that they struggle with, it's going to be different than the average support group of what maybe when you're 85 you struggle with. There's still careers, children, friendships, everything's just different.
I also think seeing more of the early onset or a younger generation being affected with the type of dementia, we're seeing a different stressor on the caregivers as well. I think there is more of the pressure to keep their loved one at home because they are younger, they should be a part of society, but there's no right or wrong way to move forward in treating or helping to cope with this disease. So going to adult day centers or bringing it home into your private home or moving into a community. I have a lot of families who won't even talk to me because they say my loved one's too young. Only old people move into a community, or they're not sick enough yet to move into your community. But my community is here to create very much the same environment that Regina's Adult Day is created to have, is that routine and that structure, and to make those hard things every day a little bit easier. So we'll take over the cooking, the housekeeping, the maintenance, and provide a structured routine so that the individual can thrive and be successful in the environment that they are in. So utilize these resources that these ladies have. There is not a path that you should follow once you get your diagnosis. Find the resource that works best for you. So that's moving into a community at 58 years old, or if it's staying at home in your environment until you're 95 years old. It's different for everybody.
Well, when it comes to that too, some of the things, just, you guys tell me, this is just a question. Do most of your clients, the people that come to you that come to look for resources or come looking for advice, is it the client with the dementia, or is it a family member, a loved one, a friend who notices it? I just know, working with my family, we didn't have the dementia issue, but I found that they hide it really, really well. They hide whatever the infirmity is, whatever the challenge is, and they can put on a pretty good show while you're there. And, I mean, what is the experience there? So, will this fall mostly on family members, or will this be the individual that steps up in most cases?
So
Go
for
ahead.
me, I've not had one individual yet be the one to contact me. It's always been the family member.
Right. I assumed that was the case. Is that pretty much across the board, or?
Yeah, for me too, it's pretty much the family member. Well, in various, like, it depends on our location. At our Guyan location, it has actually been the case managers, so to speak, from Socoa, because most of that clientele is independent. But our Fishers location and our Shelby location, it's been their caregivers or their family members.
Much of what you see, our elders are part of what we call the silent generation. So Jim, like what you experienced, they don't talk about it because that generation has been known to really handle things independently and not trouble family or not trouble any outsiders with their business, so to speak. So they tend not to share information about their financial situation, about their healthcare needs, about any changes in condition or anything like that. They kind of keep it to themselves. And then our boomer population, which is the next group of individuals, are a little more open. They have a tendency to have a much better understanding of what's going on, and they share a lot. So you'll see some changes there. What we're seeing now in the industry is there's a lot of the sandwich generation, which is the individual who's caring for not only their children that they're trying to raise, but also an aging family member who is now needing additional assistance and help. So quite often we're seeing 3 generations in one home, which is delightful to see when we do run across that. But I seem to be rambling a little bit. I want to share a story. I had a conversation with a gentleman last week in regards to the new vaccines that are out and whether or not he wanted his father to have a vaccine. And he shared with me, he says, I can't thank you and your team enough for what you've done, not only for my father, but for me. He said, I feel like I have my life back again. I feel like I can be a child again and support my dad in a different way and actually enjoy spending time with him instead of dreading spending time with him. And I think I see a lot of heads nodding. I think all of us have experienced that, where family members who finally do make a decision to either bring help in, go to an adult day center, go to an assisted living setting, participate in one of the programs that the association has to offer, to include their virtual support groups that they're offering right now, bring Jesse in, learn more through Mindy. I mean, any of those resources that are out there can really change somebody's life. And I can't encourage people enough to just pick up the phone and make that call. And we're all fantastic about, if it's something that we don't do, or if it's something that's not a good fit for us, we're going to work collectively to share resources and get that individual where they need to be and get them the assistance that they need to have.
Yeah.
One of the things that I've heard a lot of is that one of the challenges is making sure that they're getting enough nutrition, they're getting enough hydration. I think that's a situation with probably anybody that lives alone, probably anybody that's aged living alone, and then I guess dementia adds another layer to that as well. I know Vicki and Allison, you guys both talk a lot about what you guys do at your communities to resolve a lot of these things. Could you share, because people may have opportunities, they can do some stuff at home as well. So
Go ahead, Allison, and I'll
Vicki,
dovetail
you
at the
talk
end.
on this if you want. I know this is exactly what Vicki does in all of her communities, is create these programs to be successful. So I'll let her answer, then I can chime in with more specifics in case I notice anything that she didn't cover.
So I think it's important to kind of keep in mind that, as dementia progresses, the brain stops telling your body certain things. So you lose those triggers for hunger and thirst. Like we might be sitting and thinking, oh gosh, I'm kind of hungry. I think I'm going to eat. Well, those folks with Alzheimer's and dementia lose that trigger. So they don't think about, I haven't eaten all day. I'm not hungry. That doesn't come to them. The other thing to keep in mind is their depth perception starts to change. All of their senses begin to change. So food doesn't taste the same. It doesn't smell the same. Something that mom or dad may have really loved and enjoyed in the past, they just don't have an interest for anymore. So what we do in our organization is we utilize cayenne red plates. We call it our red plate program. And basically what it does is it allows the food to stand out on the plate. It provides some contrast, so those who are having some visual and depth perception issues, they'll be able to see the food on the plate. So if you think about mashed potatoes or chicken on a white or a cream colored plate, it kind of blends in. But when you add color underneath it, it stands out. Also, sometimes it's a matter of smaller portions, because they become overwhelmed with the amount of food that's on their plate. And so they might think, well, I'm not hungry. I don't want it to go to waste. That generation is not wasteful. And so they'll push their plate away. So trying small servings frequently throughout the day will help get that nutritional intake up. And of course, you can utilize some high calorie items, speak with the dietitian to put together a good diet program for them, from a caloric intake and to meet their other medical diagnoses, low sodium or whatever they may be on for cardiac. But just really trying to help things stand out, contrasting by putting even placemat underneath the plate will help that stand out visually as well. So there's a lot of different things that can be done to help with nutritional intake. Portable foods, things that they can eat easily with their hands if they're having a hard time dealing with silverware. So chicken nuggets, sandwiches in bite-sized pieces, finger type items that they can easily eat.
To add on to that is, looking at the type of food. So long pastas like spaghetti can be hard to twirl. So switch to like a bow tie or a penny. It's easier to pick up either with your fingers or the fork. Loose foods like rice or corn can be hard to scoop. So mix it into a sauce or gravy so it's easier. Just making that process of eating easier for them to achieve. Also remembering that it's going to be really hard for individuals with a dementia to focus and concentrate at the task at hand. So minimize distractions in the area, turn off the TV, make sure the lighting is bright so they can actually see what they're focusing on. And that will go back to the color that Vicki had mentioned. But just setting them up for success by simplifying the process so they can really focus and concentrate on the one task of eating.
Oh, very good. Now, Jesse, I want to pick on you. I most all of you do this as well, but I was going to pick on you to a degree because this is really where your wheelhouse is. When you're working with the dementia client, okay, the patient, you're also working with their family and the dynamics of that circular conversation. Well, we've talked about this, the frustrations that seem to come, which, could you kind of go into basically helping that family understand how to have that conversations, how to keep from the wars going on that don't need to be there? So.
Yeah, so when I go into the home, the one thing that I do is that cognitive assessment where I'm looking at the communication breakdown that's happening between not only the individual who has the diagnosis, but also with their care partner. So, based off of where they are in the disease progression, you should be communicating in a different way in order to decrease that anxiety, agitation. And so we very much teach the care partner, instead of using open-ended questions, use closed-ended questions. Instead of saying, it's time to take a shower right now. I got to go take a shower. It's your shower. You haven't had a shower in 5 days. And then the loved one says, I just had a shower yesterday. And they didn't have a shower. Maybe they haven't had a shower in a long time. More so using that language of let's go somewhere versus a demand or a command of, an uncomfortable situation. And the same as, well, what do you want for lunch today? A lot of times that can cause agitation as well. Instead, give them two choices. Do you want a ham sandwich or do you want a turkey sandwich? And with some, not even saying what do you want or do you want one of these two options, but actually just preparing the meal and presenting it to your loved one, because oftentimes the individual is going to say no, they don't want anything, when really they likely do want something. And when there's that agitation, it's also looking at those things of, there's a trigger there. So are they cold? Are they hungry? Are they tired? Are they thirsty? Are they uncomfortable? Are their clothes uncomfortable to them? Looking at those things, stepping outside and looking at those things can be helpful to try to even decrease an agitated, interaction between the care partner and their loved one.
Anybody else want to tap in on that one? Or those are things that I think that we all, that you hear constantly, and you hear the frustration and the fact that we've gone over this. So thank you for helping us go through that. We're getting down to we're running out of time here. I don't want anybody to not have something that they want to say to get to say. Does anybody have something you really would love to make sure that people know? So you're big on my screen right now, Jesse. So is there something you would like to weigh in on?
No, I want Mindy to go.
Okay.
Well, I don't mean to take us back, but I think this kind of brings us full circle, and I really hate to leave on this statistic, but I think it reinforces the need for just tapping into the resources and what you've heard of today. One thing we talk about in our Dementia Friends sessions, and just kind of talking about that burden on the caregivers, we find, especially with spousal caregivers, when they fall between the ages of 66 and 96 and they're caring for their spouse with some form of dementia, they actually have a 63% increase in mortality rates that compared to their peers who are also caregivers, but not caring for somebody with dementia. So, that popped up in my head way long ago. There was probably a more fitting place to put that, but I think that just to bring it full circle, you don't need to do this alone. It's impossible to do alone. And whether it's a support group that is your form of getting support, maybe it's taking a walk around the block, maybe it's a phone call to your best friend or your grandchild. I mean, caregiver support comes in all different forms and fashions, but we need to tap in somehow, and we need to know, and we need to accept that it's okay to not do everything on our own. I think, I can't remember who was talking about it, but that was my grandpa. He was so strong-willed. He was keeping my grandma at home, and he did keep her successfully at home. But we never had any aides coming into the home. We never knew about area agencies on aging. We just never knew about the resources that could have helped him also have a life. Just like Vicki was saying with the son, it just boils down to quality of life. And yes, you may physically be able to do those tasks on your own, but you don't have to. There's folks that can come in and provide that support. So just know that your health is just as big of a priority as the people that you're caring for. And so fill that cup up with some sort of support somehow. So.
Oh, very good. Hadia, go back. You've got the different events coming up, different things that are coming up that you can support. I know that you mentioned the 4 for the young onset, but I remember getting that email. You've got a whole bunch of stuff coming up. Would you like to talk more about what's coming up?
Absolutely. Yes. Every single month we have tons of education programs and support support groups, and other events going on. So please, I encourage you to check out our alz.org/CRF, which is our community resource finder. You can find all of the wonderful resources we talked about here today on there, as well as the programs that we offer. So I encourage you to go check those out. I also owe you all some quick definitions, that aren't just my hodgepodge. So I'll let you know, vascular dementia, as I said, is a general term for thinking impairment caused by disruptions in the brain's blood supply. So this typically happens as a result of a stroke. Lewy body dementia happens because a Lewy body is an abnormal structure that develops in the brain cell. So symptoms that come with that are frequent falls, temporary loss of consciousness, and hallucinations. So watch out for those. And then frontotemporal dementia, the major difference between frontotemporal dementia and Alzheimer's disease is that FTD primarily affects behaviors, speech, and Alzheimer's mainly affects memory. FTD also occurs earlier. So a lot of times when people have younger onset Alzheimer's, they may be looking at a case of frontotemporal dementia. So I had to share those since I promised them, but my last thing was what Mindy said. I love that these women always say what you were thinking, so you don't have to worry about it, but you cannot and should not go through this alone. Whether you're living with the disease or you're caring for someone, do not, because we are here for you. So please reach out to us. Thank you, Jim.
And back to many dementia friends, just give a pitch to how people can find out about it, get involved in it, and what have you there.
Absolutely. So I don't think I really touched much on this, but we offer 1 hour. We call them information sessions. So kind of like the educational programs that had referred to. This is kind of you could say a bit of an introduction, but it does a nice job of kind of giving you a different perspective of how to look at the condition. And again, the sole focus is really helping us break down the stigma of this condition and helping to show what actions we can take, small actions we can take to make the lives better for people living with dementia. So I think the best way, if you are tech savvy at all, or really not even tech savvy, but just go ahead and jump on www.dementiafriendsindiana.org, and I can put that in the chat and share. But we've got some partners statewide who host sessions. So there's a nice listing for January of different virtual sessions that we're doing, just like we're here right now. But those are just 1 hour sessions. They're free to join. And again, just I think that is the best way to look for us. So you can also find information at SACOA's website as well. So CICOA.org. And again, SACOA is the state administrator. So just to make that tie for people that they're not two separate organizations, it's SACOA's program. So
perfect. Well, I'm going to do a real quick screen share, and then we will take a look at something. Basically, I want to let you know what's coming up. You go to Life's Copilot, you can always go to click on events. And we just finished this one. And the 26th, we're going to be doing one on everything you need to know about downsizing, getting rid of real estate, turning it into a rental, you name it. We got Airbnb managers there telling you how all the different kinds of ways you can do it. On the 11th, we're going to do one on Parkinson's. On the 23rd, on pre-planning final expenses. On March 11th, we're going to be doing one on new and improved medical ideas and how that works. And then on the 23rd, everything you ever want to know about Medicare. So those are some of the upcoming events. And thank you all for being here. Once again, you guys rock. So I appreciate it. And we will see you soon. So look forward to seeing you on Life Copilot and on the street here shortly. All right, take care, guys. Bye-bye.
Thank you so much.
Thank you.
Bye-bye.